So what do you do if you're a patient and you go to one of these clinicians that are, like I said, this is a touchy subject because there are some clinicians out there that say, no, don't ever take it off, don't remove it. So they sit in the chair, they're interviewing the clinician. By the way, guys, that's a great question. Ask them, what is the maintenance look like during the healing stage? What is that first month appointment? Will they remove it? Will they, but if they ask a doctor and the doctor says, and he makes an argument, oh, you never want to take out the prosthesis, and he tries to, but they feel convinced after watching you and hearing this that it is a good move to have that out. Should they just go somewhere else, or should they tell the dentist that, hey, no, I want to come back and do this? Or what would be your recommendation to that patient?
I think you touch on a very important point, which is the trust and confidence of the communication, or the portal communication between the patient and the clinician. If the patient is comfortable to asking the clinician, or if the clinician is the one that dictates the treatment and doesn't give the opportunity to the patient to ask questions, then that is the point when I say, maybe it's not a good fit. If a clinician doesn't spend enough time with you to be able to answer your questions, and you're gonna go through this expensive procedure, yet also life-changing event, you deserve to ask your question. And get your questions answered. Now, the fact that we do remove the prosthesis, again, I wanna make sure that the point is well taken, as we come from a periodontal gum infection perspective and point of view. I don't want to discredit my colleagues or my other clinicians because they do not do it, right? For us, it's only a recommendation of our observance and of knowledge in science, scientific approaches and things like that, right? But there have been numerous, and this procedure is performed in a daily basis all throughout the country, and hundreds and hundreds of cases every day. And this treatment is still very successful. So yet, I'm not saying that because I recommend the removal of that prosthesis and the maintenance of that if your clinician doesn't do it, it means that it's gonna fail. No, it's probably not gonna fail. I mean, if not, we will have critical numbers of failures in the country. So for us, it's only a recommendation. It's a good idea for you to have this conversation with your clinician if you already have depart from the understanding of how gum disease could occur around implants, and see what your clinician has to say. It doesn't mean that he or she is a bad clinician because doesn't take it out. It's just a different approach, right? But at one point in time, it should be taken out. Whether it's 1 month or 1 year or 6 months, whatever that's taken out, or at the time of conversion, at one point in time, you do need to have a maintenance appointment along the lines, right?
It's a great
So
point.
just have a communication with your clinician.